Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps including Apple Podcast, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, the Virginia Audio Collective, and the Family Podcast Network. Podcast episodes also air each Sunday at 9 a.m. on 100.5 FM, 92.7 FM, and 8:20 a.m. across Central Virginia, 1650 a.m. in Hampton Roads, 105.1 FM and 1050 AM in Lynchburg, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to PCFpodcast at VHHA.com. Again, that is PCFpodcast at VHHA.com. And today we're pleased to be joined by Dr. Mark Witcher, a functional neurosurgeon with Carilion Clinic. Dr. Witcher joins us for a conversation about his work with patients with movement disorders, chronic pain, and epilepsy, as well as a recent trip he and some neurosurgery residents took to a remote corner of the world to provide clinical care to patients in need. We'll discuss all that in just a moment, but first, welcome to the show, Dr. Witcher. Thank you for being with us.
Thank you so much. I really appreciate the invitation to be here today.
Well, we're glad you could join us, and so let's just dive right in. We like to start each episode by getting to know our guests a little better. We know, as we mentioned, that you're a functional neurosurgeon who works with patients with movement disorders such as tremors and Parkinson's disease, chronic pain, and epilepsy. You also specialize in trauma and surgical critical care. You're board certified in neurological surgery, and you did clinical training, fellowship, and residency at academic medical centers in Georgia and North Carolina. So those few details, I'm sure, only scratch the surface of who you are. So beyond that, what are some essential things about your unique personal story that you can share with us?
Ooh, that's a great question. So my plan as an adult was to be a professional ecologist and environmental scientist, and actually worked in that field for several years. And then just through a series of circumstances, ended up deciding to go to medical school and pursued an MD, PhD degree. So a combined approach to try to better understand the world around me and mankind's health within it. The background as an ecologist actually led down that road, as I was very interested in environmental neurotoxicology and really saw a future there. Well, life goes, I guess, not according to plan sometimes. And I ended up meeting some very influential individuals, and again, related to that field, that showed me that my true path was to go into neurosurgery and then on to functional neurosurgery. And it's just been an incredible journey since then.
Well, double doctor, that is quite impressive. And I will tell you, we actually recorded earlier today with Dr. Bob Tressman, also of Carilion, for a separate episode. And he also is an MD and a PhD. So I guess today is a day of double doctors. So appreciate you sharing that background with us. Let's talk a little bit about some of the conditions that you're involved in treating. We mentioned things like Parkinson's disease, chronic pain, epilepsy, things like seizures. Some of these things now can be treated with minimally invasive brain surgery techniques. Another technique I know you've worked with is the use of implants known as deep brain stimulation to help patients dealing with Parkinson's and other movement disorders that can cause visible tremors. If you would, tell us a bit about those conditions and the surgical options that are available to address some of the symptoms they cause in some of the patients that you may work with.
Sure thing. So the field of functional neurosurgery implies that we are trying to change the function of the nervous system. And we tend to do this through neuromodulation. And so, again, the implication there, we're using either chemical means or electrical means to stimulate parts of the nervous system to achieve the desired function. And so it sounds that some of these fields might be a little bit disparate, but when you look at it through the lens of modulating abnormal function of the nervous system, it makes sense why epilepsy and movement disorders and chronic pain all fit into that realm. So the Parkinson's disease patients and the essential tremor patients make up the majority of the movement disorder patients we see. There are a few others. And we've had really good technology for the past 30 years or so to be able to treat those patients using the deep brain stimulation that you mentioned. I mean, that is composed of a wire that goes to very specific targets within the human brain. That are then connected to generators or batteries with small computers on board. They all get implanted in the body. And they can help regulate the abnormal oscillations that would otherwise lead to tremors and some of the other cardinal features that we see in Parkinson's disease. We've also developed new technologies over the past few years using things like focused ultrasound which is an incisionless surgery where sound waves are applied to the brain. And we can create a small lesion within the brain in order to treat those same types of problems with tremor, as well as dystonic movements and other problems that come along with some of these diseases. In the epilepsy world, we have similar options. We have devices which can be implanted into the brain so that we can treat seizures which have failed medical treatment. And then, as you mentioned, we've developed minimally invasive options such as laser surgery, where a small laser fiber can be placed into the brain through an incision no bigger than about a quarter inch so that we can actually remove the parts of the brain that cause the seizures. In the chronic pain space, it's kind of the same idea that we can have electrical or chemical devices be implanted in the spine or in the peripheral nerves in order to stop the chronic pain that so many patients are debilitated by.
Well, that's a fascinating explanation. I appreciate you taking us down that path. I want to talk a little bit more about neurosurgery. You mentioned a few moments ago that your original path had you on a course to be an ecologist, and then how you had some influential people in your life that steered you towards the passion that you have for neurosurgery. As a layperson, I will say that the idea of having responsibility for another person's medical well-being seems daunting on its face. And clearly every organ in the body is important. But to me, again, as a layperson, I look at and think of the brain and the heart as being right up there in the hierarchy. So I'm interested in hearing your thoughts as a neurosurgeon about the immense capacity and potential of the brain and your perspective as someone whose interventions involve brain surgery.
Yeah, I think you make a really valid point. I mean, at the end of the day, the brain and the way it functions is really what makes us who we are as individuals. I think there's really probably not another organ in the body that would be such a kind of personalized thing for us. And so it is a great responsibility, and it's also a great privilege to be able to take care of patients with those disorders and to be able to earn their trust such that you can work with them and really help them, get the most out of life. And when I think about that, we think about quality of life, we think about quantity of life. And in our discipline, throughout neurosurgery, regardless if it's functional or other types, we really deal in both of those ideas of quantity and quality of life being optimized for our patients. And so it's, again, just an enormous honor and privilege to be able to serve patients in that way.
Well, I certainly want to say thank you for the work that you do. I know that you're making a difference in people's lives. As you said, restoring quality of life as well as allowing them not just to regain that quality, but also to do it over an extended period of time. We hinted at this earlier, but your work isn't limited just to the Roanoke area or the U.S. We're recording this in May of 2024, and last month, April, for World Health Day, you led a team of neurosurgery residents on something of a medical mission trip. Your team trained dozens of surgeons in Nepal, which is a mountainous nation in South Asia that's widely recognized for its connection to the Himalayas, a mountain range with some of the highest peaks on the planet, including Mount Everest. Your team consulted with more than 100 local patients and performed 6 successful surgeries. You also provided the Nepalese government with a donation of surgical equipment valued at $60,000. I wonder, and that's to support ongoing medical interventions and treatments for patients and clinicians still in that nation. I wonder if you could tell me about that experience and perhaps some of the backstory about how that came to be.
What an incredible opportunity that was. So the backstory of how it came to be was a fairly organic development over time. I have the privilege of directing our residency training program at Carilion Virginia Tech. And during interviews a few years ago, we interviewed an applicant. We did hire this person from Nepal that was very interested in taking back what he could learn in serving the people that surrounded him as he grew up. He's been in the U.S. for the majority of his adult life, but truly has a heart of service and really wants to give back to that community. And so we did want to start that several years ago, but with the pandemic and so many of the travel restrictions and health restrictions that came about, we postponed it until we felt that it was a safe and appropriate time to go. And so we actually went on a bit of a reconnaissance trip last year in 2023 and met with the directors of 2 hospitals that derive the vast majority of their funding from government sources and serve the public there. And so we interviewed them while we were there and asked, if there was something we could do to help here, what would you want that to be? And they identified several areas that I felt would be areas that we could really help lend expertise, and then also learn a lot from the healthcare systems there. And so the things they asked was to help kind of formalize research and help publish research of the different healthcare that they deliver there. And so we started that project immediately last year, looking at healthcare outcomes for a pretty common neurosurgical surgery across our healthcare center, as well as another in the U.S., as well as those in Nepal. And that's an ongoing project involving medical students and residents that we have not yet concluded, but it's turning into a very interesting project. The other thing they asked is if we could bring in functional neurosurgery as well as endovascular neurosurgery, which is another subspecialty area, but both of which they had never had access to training within the country of Nepal. And so the trip this year was to really enact that. So we spent the last 12 months gaining resources, donations, and building a game plan of how and where we could be most effective in helping deliver our knowledge set and our expertise into the hands of Nepalese neurosurgeons so that they could continue the work there independent of us. And so through that, we were, as I said, able to acquire sets of equipment that could be deployed there multiple times and serve patients that would never have access to it outside of being in the Nepalese public healthcare system. We recognize also, though, there are patients that do have a choice as to how their healthcare is delivered within Nepal. And so we built, in somewhat of a modular fashion, several service lines where the physicians there could actually apply different technologies to be able to serve the patients with state-of-the-art techniques, technologies, and outcomes. And so when we arrived in country, as you say, we saw about 100 patients that was scattered over the course of a few days. And then we were able to introduce these surgical techniques that just had never been really performed there before. And again, what an amazing experience that was. The patients we served were chronic seizure patients or epilepsy patients, as well as Parkinson's disease patients. And I tell you that it is as magical and as amazing as we felt it was going to be. We're able to see and do so much more than we thought we would ever be able to watch patients come in, with these movement disorders, with a tremor that is just disabling, and to walk out of the hospital tremor free. It was just one of the most rewarding opportunities that we've had.
Well, I think the word you used, magical, to describe it, I think sums it up. It sounds like you and the team made a real meaningful difference in the lives of those patients who had surgical interventions. But then, as you say, there is ongoing benefit through the surgical equipment that was donated and will remain in country, as you say, and then also through that ongoing research initiative that the physicians and clinical staff there had some interest in. So it sounds like that's a lasting positive benefit. So appreciate you and the team doing that and you sharing that with us. We are close to wrapping this up, but before we do have a tradition, Dr. Witcher, here on the Patients Come First podcast, to close things out with a pair of fun personal questions for each of our guests. To keep things interesting, we have a list of 10 mystery questions. So if you select 2 numbers between 1 and 10, I will ask you those corresponding questions.
Oh, wow. My fate is in my hands. I will choose 3 and 9.
Okay. 3 and 9. 3, what is the best piece of advice you've ever received, and why is it meaningful to you, or why does it remain with you?
I think that would have to be to follow your passion. I think whenever I was making the transition from being an ecologist to becoming a neurosurgeon, there are a lot of obstacles, perceived and real, along the way. There's a lot of mental roadblocks that we can easily put up for ourselves and succumb to if we don't. And I received the advice of, you live once, follow your passions and do it. And I think that is just one of the most profound pieces of advice that I've ever had the sense to listen to and follow. And I would encourage everyone to do that in their own lives.
Indeed. Really maximize that life. As they say, as the kids say today, YOLO. So, and then number 9, if you were miraculously granted one wish, what would you wish for?
Oh, wow. You know, I feel so blessed and fortunate to be able to live the life that I do right now. And I think it would be to be able to serve a greater number of people. We unfortunately only have 24 hours in a given day and can only do so much. And I would love to be able to kind of spread out that resource and just be able to serve more.
Time is the one commodity that none of us can acquire more of. Well, listen, Dr. Witcher, it's been a pleasure getting a few moments to speak with you, to learn about your work, to learn about your mission trip, and all of the positive impact that it's having. And with that, that brings us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so that you know when new episodes are available. And we want to once again thank our guest, Dr. Mark Witcher of Carilion Clinic, for joining us today. So thank you, sir.
Thank you, and thank you so much for your time. I really enjoyed our conversation.